Once you go to the book and you realize there's these 50 to 60 chief complaints and you got to do the differentials, yeah, repetition matters. And there's lots of ways of varying that repetition. If you want to put them on cards and say shortness of breath, chest pain, abdominal pain, edema, perfectly fine. There's lots of boring moments in life. You're on the subway home. Get out your cards and practice them. Case studies are always written about this. If you want to see how doctors do this, go to serious journals and read their case reports and just marvel at how it's always this. Other things you can do, multiple choice questions. Good multiple choice questions demand that you follow the discussion, not look for some buzzword or hook that's going to bail you out. You're never going to get it. So there's lots of ways of practicing it. Frankly, the best way is to do patient care. But let's face it, that's not going to happen in a way that's volume enough for you to do. I think the really best way, after you've been practicing your cards and you think you're getting the hang of it and you've done some cases and it worked great, come and talk to me. That's what we do. I talk to students all the time and we start with, hey, what did you see this week? Or what were you thinking about? Or you didn't get this question. And we just start talking. And you realize these are all stories. So once you get the story, you all know how Little Red Riding Hood works. Well, I promise you, left ventricular congestive heart failure, you just haven't heard it as many times as you heard your fairy tales. But once you've heard it enough times, it's just, you know where the plot goes and it's always the same. And boy, does that make things easier.